Join us as we address a topic that impacts countless lives: depression. This episode complements the Treating Depression Training 2023 course by Therapy Trainings, providing mental health professionals, counselors, and therapists with insights to enhance their approach to this widespread condition. In the next few minutes, we'll explore the definition of depression, differentiate between various depressive disorders, and discuss the multifaceted causes behind them. We'll also look at risk factors in vulnerable populations, assess the impact of depression on overall well-being, and cover effective treatment strategies. Plus, I'll share some common misconceptions surrounding depression and offer practical insights that can enhance your practice. So let's get started. First, let's define depression. At its core, depression is more than just feeling sad. It's a complex and often debilitating mental health disorder characterized by persistent feelings of sadness, loss of interest, and a host of emotional and physical problems. In the course offered by Therapy Trainings, we discuss different types of depressive disorders, including major depressive disorder, persistent depressive disorder, and seasonal affective disorder, among others. Each of these has distinct features and diagnostic criteria, which are vital for effective treatment planning. For instance, major depressive disorder is defined by the presence of at least 5 specific symptoms, such as depressed mood, fatigue, feelings of worthlessness, and impaired concentration, lasting for at least 2 weeks. On the other hand, persistent depressive disorder, or dysthymia, is characterized by a chronic low mood lasting for at least 2 years. Understanding these distinctions helps in tailoring treatment approaches to meet individual needs. Now, let's talk about the underlying causes of depression. It's essential to recognize that depression rarely arises from a single factor. Instead, it's the interplay of biological, psychological, social, and environmental influences that shapes an individual's mental health. For example, biological factors can include genetic predisposition or neurochemical imbalances, while psychological influences might encompass a person's coping mechanisms and cognitive patterns. Social factors, such as relationships, community support, and socioeconomic status, significantly impact one's mental health. Environmental influences can range from trauma and stress to life transitions and changes. Have you ever considered how these elements might intersect in a client's life? Recognizing these complexities allows us to adopt a holistic approach in our assessments and treatment plans. Speaking of assessments, let's delve into the importance of effective evaluation methods. To accurately diagnose depression, mental health professionals must be proficient in using evidence-based assessment tools and conducting thorough clinical interviews. In the course, we highlight several standardized instruments, such as the Beck Depression Inventory and the Hamilton Depression Rating Scale, which can help gauge the severity of depression and monitor treatment progress. But remember, while these tools are invaluable, they should complement, not replace, a comprehensive clinical interview. This is where your skills as a therapist really shine. By engaging clients in meaningful conversations about their experiences, you can uncover underlying issues that standardized tools might miss. It's about building rapport and trust, which can ultimately lead to better outcomes. Now let's discuss treatment planning. Developing effective treatment plans tailored to individual needs is crucial in managing depression. The course emphasizes evidence-based best practices, which can include a combination of psychotherapy, pharmacotherapy, and alternative approaches. Psychotherapy encompasses various modalities, such as cognitive behavioral therapy, or CBT, which focuses on changing negative thought patterns, and interpersonal therapy, which addresses interpersonal relationships and social functioning. It's fascinating how different therapeutic approaches can resonate with different clients, isn't it? Pharmacotherapy, or the use of medication, is often indicated for those with moderate to severe depression or for those who may not respond adequately to psychotherapy alone. As practitioners, it's essential to stay informed about the latest developments in psychopharmacology to provide clients with the best options available. And let's not overlook alternative approaches. Techniques such as mindfulness, yoga, and nutritional counseling can also play a pivotal role in a holistic treatment plan. Encouraging clients to explore these options can empower them on their journey to recovery. As we discuss treatment, it's essential to consider the role of family and social support in the recovery process. Depression can be isolating, but a strong support system can make a significant difference. In therapy training's course, we emphasize the importance of involving family members in treatment when appropriate. Educating loved ones about depression can foster understanding and create a supportive environment for the client. Additionally, we should recognize potential comorbidities associated with depression. Many individuals with depression also experience anxiety disorders, substance use disorders, or chronic physical health conditions. This overlap can complicate treatment and requires a more comprehensive approach. By addressing these comorbidities, we can better support our clients and improve their overall quality of life. Now, let's take a moment to address some common misconceptions about depression. One prevalent myth is that depression is simply a result of personal weakness or a lack of willpower. This belief can lead to stigma and may prevent individuals from seeking help. As mental health professionals, we must educate our clients and the broader community about the reality of depression as a medical condition influenced by a myriad of factors. Another misconception is that treatment for depression is a one-size-fits-all approach. The truth is, what works for one person may not work for another. This is why it's vital to tailor treatment to the individual's unique needs and circumstances. Encourage your clients to be active participants in their treatment journey and explore different modalities and interventions. As we near the end of our discussion, I want to highlight the importance of self-care and maintaining professional boundaries when working with individuals experiencing depression. As therapists, we often pour our energy and empathy into our clients, but it's crucial to care for ourselves too. This means setting boundaries to prevent burnout and ensuring we have our support systems in place. Take time for your own mental and emotional well-being. Engage in activities that replenish your energy, whether it's exercise, spending time with loved ones, or pursuing hobbies. Remember, you can't pour from an empty cup. To wrap up today's episode, I hope you've gained valuable insights into the complexities of treating depression. From understanding the various types of depressive disorders to recognizing the importance of holistic treatment approaches, there's a wealth of knowledge to empower you in your practice. As you continue your journey in mental health care, I encourage you to explore the course Treating Depression Training 2023, offered by Therapy Trainings. This course offers 5.5 CE hours and is designed to equip you with the skills and knowledge needed to support your clients effectively. You can find more courses at therapytrainings.com, where you can continue to expand your expertise in mental health. Thank you for joining me today, and remember, every step you take to understand and treat depression brings us closer to a world where mental health is prioritized and stigma is diminished. Until next time, take care of yourselves and each other.